Welcome to Pharmaceutical Calculations. Today we will be practicing calculations based on milliequivalent, osmolality and fluid dynamics. These calculations are important because they determine whether the patient receives the right dose or not. How to convert milligram to milliequivalent? First, we should know what is equivalent weight. Equivalent weight is the number of atomic formula unit divided by the valence. Conversion from milligram to milliequivalent. So milliequivalent equals to milligram into valence divided by the formula mass or atomic mass or molecular weight, whatever is given. Now in solution for liquid formulations like syrups, antibiotics, intravenous infusion, IV fluids, we convert milligram per ml using this formula, the given amount in milliequivalent per ml multiplied by the atomic mass divided by the valence. For example, how many milliequivalents of magnesium sulfate are represented in 1 gram of anhydrous magnesium sulfate? First, we must find out the milliequivalent weight of magnesium sulfate. The atomic mass of magnesium sulfate is 120 and the valence of magnesium is 2, so we divide them. 1 milliequivalent of magnesium sulfate is equal to equivalent weight of magnesium sulfate divided by 1000, because we need to change the gram into milligram. So we get 60 milligram magnesium sulfate, which is equal to 1000 milligram divided by the unknown concentration of magnesium sulfate milliequivalent. We find out X as 16.7 milliequivalent. Another example, what is the concentration in milligram per milliliter of a solution containing 2 milligram of potassium chloride per milliliter? So the formula we have milligram per ml equals to milliequivalent per ml multiplied by the atomic weight divided by the valence. So 2 milliequivalent multiplied by 74.5 divided by 1, we get 149 milligram per ml. Another example, what is the concentration in milligram per milliliter of a solution containing 4 milliequivalent of calcium chloride? Calcium chloride per milliliter. So 4 milliequivalent of calcium chloride is equal to 294 milligram per ml. By using this formula, we calculate it how much gram per ml given. 0.294 gram per ml is the amount of calcium chloride that is present in the solution containing 4 milliequivalent of calcium chloride. So what is the percentage concentration of a solution containing 100 milliequivalent of ammonium chloride per milliliter? The molecular weight of ammonium chloride is 53.5. So 100 milliequivalent per liter means 100 milliequivalent per 1000 ml multiplied by the molecular weight 53.5 divided by the valency. So we get 5.35 milligram per ml as the answer. Now from here 5.35 gram per liter, that is 1000 ml, is equal to X gram per 100 ml. So we find out the concentration of ammonium chloride, the solution, that is 0.535 gram. A person is to receive 2 milliequivalent of sodium chloride per kilogram of the body weight. If the person weighs 132 pounds, how many milliliters of 0.9% sodium chloride solution should be administered? Now the weight of the person is an important criteria for determining the amount of dose that is to be given both orally or in IV solution. It is very important to consider the weight and age of the patient. So 132 pounds should be converted into kilogram. By dividing it by 2.2, we get as 60 kilogram. So 2 milliequivalent per kg into 60, that is the weight of the person So we get 120 milliequivalent of sodium chloride. So milliequivalent into the atomic mass by the valence. So 120 milliequivalent into 58.5, we get 7020 milligram. Now convert this by dividing it by 1000 into gram NaCl. So we get 7.02 gram NaCl. Now we have to find out the concentration. This concentration that is present in how many ml of the solution. So 0.9 gram is present in 100 ml. So 7.02 gram should be present in x ml. From there we find out x as 780 ml. Another question: how many milliequivalents of sodium ion would be contained in 30 ml dose of the following solution? Like disodium hydrogen phosphate, sodium biphosphate, the solution total volume is 100 ml. So we must consider both these salts separately, find out the concentration of the sodium ion in milliequivalent, and then add to get the final concentration or the total concentration of sodium. Disodium hydrogen phosphate, the formula molecular mass is 268 and valence is 2. Put it in the formula. Milliequivalent equals to milligram into valence divided by the atomic or the molecular mass. We get as 134.3 milliequivalent. Now 134.3 milliequivalent is present in 100 ml. So x milliequivalent is present in 30 ml. We find out x as 40.3 milliequivalent. For another compound, sodium biphosphate, the valence is 1 and the formula or the atomic mass is 138. We get the milliequivalent of sodium that is present in sodium biphosphate by using the same formula, milligram into valence divided by their atomic or the molecular mass. We are finding out the milliequivalent that is present in the 100 ml solution. So from there we can find out what is the amount of milliequivalent present in 30 ml of the solution. In our final step, we combine the two sources to find out the total amount of sodium ion present in 30 ml of the compound. Now, osmolarity and fluid dynamics. When we are dealing with patients which require IV infusions, we have to consider osmolarity and osmosis. There are several conditions where osmosis and osmolarity plays a vital role. But first we should understand what is the meaning of osmolality. It is the pull or the force of a solution inward towards the dissolved solute. It is same that osmolarity that we have studied in our high school. So osmolality is usually the concentration of the solute in a solution, written as osmoles of solute per kg of the solvent. It is the ability of the solution to exert osmotic pressure or force that moves water across the semi-permeable membrane. Now, osmotic pressure is the force or the strength of the solute to pull water into the solution. Osmosis moves water from the lower osmolarity, that is the lower concentration of the solutes, or the higher concentration of water, to higher concentration of solute or lower concentration of water to higher osmolarity. It is the water that moves back and forth, not the solutes, until there is the same relationship of water to the solute on both the sides. So until equilibrium is established. The greater the difference in osmolality between the two compartments, the greater is the osmotic pressure, and the water will move towards the solutes to balance the concentration. What are the osmolality drivers? Compounds like sodium, glucose, urea account for most of the force of osmolality. The albumin discrepancy. The albumin contributes minimally to overall serum osmolality, yet it is absolutely crucial for maintaining oncotic pressure. What is oncotic pressure function? Primarily generated by albumin, oncotic pressure plays a critical role in maintaining the fluid balance by drawing water into the bloodstream. The pressure balancing act. It works in concert with the hydrostatic pressure to regulate the net movement of the fluid from the vascular to the interstitial spaces in the different compartments of the body. Albumin dominance is because of high concentration and osmotic activity. Albumin is responsible for about 70 to 80% of the total oncotic pressure. What are the changes that causes change in osmolality, and what is the consequences of the change in osmolality? So if there is an increase osmolality, which happens in case of dehydration, hypernatremia, hyperglycemia, ingestion of toxic substances such as ethanol or methanol. Now decrease osmolality in case of overhydration, hypernatremia and other electrolyte imbalances. Normal serum osmolality is 275 to 295 milliosmol per kg. The body function optimally is within this range. So there is a mild elevation in case of dehydration or hyperglycemia, where the symptoms are thirst, dry mouth, fatigue, nausea, mild joint or muscular discomfort. There is a moderate elevation of 310 to 320 milliosmol in case of dehydration, diabetes insipidus, hyperglycemia. So in that case there is increased thirst, decreased skin turgor, tachycardia, lethargy, mild confusion, muscle weaknesses. Severe elevation can be observed in case of severe dehydration, diarrhea, vomiting and advanced hyperglycemia, where the blood glucose level is more than 600 mg per deciliter. In case of renal failure with uremia, where high BUN increases osmolality. So what are the symptoms? There is confusion, disorientation, extreme fatigue, there is irritability, agitation, dizziness or even fainting, and muscle twitching resulting in seizures. Now critical elevation is 340 to 380 milliosmol per kg, where the symptoms can be stupor, seizures, focal neurological deficits such as hemiparesis, risk of vascular complication, thrombosis or hyperviscosity. Causes can be osmolar hyperglycemic state, severe natremia, more than 160 milliequivalent per liter, accumulation of toxic substances from kidney failure. Over 90% of the compounds are toxic from the kidney. Osmolarity increases because of the retention of these harmful chemicals. Extreme elevation can result in hyperosmolar coma. Symptoms are loss of consciousness, that is coma, seizures, hypotonic tension, cardiovascular collapse and multi-organ failure. Causes are severe hyperglycemia, where the blood glucose is more than 1000 mg per deciliter, severe hypernatremia and extreme dehydration in case of diabetes insipidus, no fluid intake, diarrhea and vomiting. Now how we calculate serum osmolarity? The serum osmolarity depends upon the concentration of sodium ion in milliequivalent per liter, glucose milligram per dl divided by 18 plus the BUN ratio divided by 2.8, where sodium and potassium are plasma concentration in milliequivalent and BUN and glucose concentration are milligram per deciliter or 100 ml. So example is, you have to estimate the plasma osmolality in milliosmol per kg from the following data. Sodium is given as 136 milliequivalent per liter, potassium 5 milliequivalent per liter, BUN 26 mg per 100 ml and glucose is 90 mg per deciliter. Using the formula, plasma milliosmol per kg equals to 2 times the concentration of sodium and potassium ion plus BUN divided by 2.8 plus glucose divided by 18. Another example, how many milliosmol of monosodium sodium phosphate are present in 100 gram of the substance? So 138 gram equals to 1 mole. So 100 gram equals to x mole. So we can find out the millimole of the substance monosodium sodium phosphate in 100 gram of the substances. Okay, it depends upon the total number of the particles in the solution. So dissociation plays a critical role in calculation. Dextrose is a non-electrolyte. So 1 millimole equals to 1 formula weight in milligram, that equals to 1 milliosmol. Sodium chloride is an electrolyte. It will dissociate into two particles. 1 milliosmol equals to 2 milliosmol, assuming complete dissociation. Calcium chloride electrolyte dissociate into three particles. Milliosmol per liter, weight of the substance, gram per liter divided by the molecular mass into number of species into 1000. So sodium citrate, an electrolyte, will dissociate into 4 particles, 3 sodium ion and 1 citrate ion. 1 millimole is 4 milliosmol of ions. Milliosmolar value of separate ion of an electrolyte may be obtained by dividing the concentration of the ion in milligram per liter by its atomic weight. Osmolar values of the whole electrolyte in the solution is equal to sum of the milliosmol values of the separate ion. Example, 0.9% sodium chloride in milliosmol per liter. Weight of sodium chloride divided by the formula mass into number of species into 1000. So using this we get around 300 milliosmol per liter. Therefore the ideal osmolarity of the solution is 300 milliosmol per liter, but the actual osmolarity is approximately 286 milliosmol per liter, and manufacturer may label the product with calculated ideal osmolarities or with experimental or actual osmolarities. It is important to identify this distinction in practice. What is the difference in osmolarity versus osmolality? Osmolarity is milliosmol of solute per liter of the solution, whereas osmolality milliosmol of the solutes per kg of the solvent. It is measured by osmometer. Normal serum range is 275 to 300 milliosmol per kg. Abnormal values can occur in the event of shock, trauma, burn, water intoxication, electrolyte imbalance, hyperglycemia, or renal failure. A solution containing 5% of anhydrous dextrose in sterile water for injection, how many milliosmol are represented by this concentration? So 5% of dextrose solution is 5 gram per 100 ml. Since dextrose does not break into any species, so we will take as 1 as there is no dissociation. So it will be 50 divided by 1000 ml, that is 50 gram per liter. Milliosmol will be 50 gram divided by 180 into 1 into 1000. We get 278 milliosmol per liter. That is the osmolarity of dextrose in the blood. A solution containing 156 milligram of potassium ion Z39 per 100 ml, how many milliosmol are represented in a liter of the solution? Potassium is already dissociated, so we don't know what is the source of the electrolyte. So we take the number of species as 1 and find out 56 milligram in 100 ml it is present, so it will be 1.56 gram in 1000 ml as 40 milliosmol per liter. A solution that contains 10 milligram percentage of calcium ion, the atomic weight is 40 gram for calcium. So how many milliosmol are represented in 1 liter of the solution? 10 milligram percentage means 10 milligram in 100 ml. So 0.1 gram per liter. So what is the milliosmol per liter? Milliosmol per liter is 0.1 gram divided by the Z, that is the atomic number, into 1 into 1000 is 2.5 milliosmol per liter. What is the daily water requirement for a healthy adult person? Is given in ml per meter square per day, that is 1500 ml per meter square body surface area. So how we will calculate? 1500 ml plus 20 multiplied by weight and subtract 20 kilogram. So daily is 20 to 35 ml per kg. What is heparin? Heparin is an anticoagulant that prevents the formation of blood clots. Like insulin, it is also measured in units of activity. Heparin may be administered by standard gravity flow or infrared infusion devices using IV route. So the normal adult heparinizing dose is 20,000 to 40,000 units per 24 hours. In general, IV heparin is ordered in units per hour. Heparin may also be ordered by the physician to infuse predetermined flow rate in ml per hour. The heparin dose may be calculated by a method of proportion, and this can be explained in the following example. This example, heparin dose of 120 units per kg of the body weight has been recommended for a patient undergoing certain type of surgery. How many ml of injection containing 5000 heparin unit should be administered to a 220 pound patient? So here we have solved it. For x, we find out 12,000 unit. So 5000 is present in 1 ml, 12,000 is present in 2.4 ml. Patient is receiving an IV drip of the following, that is sodium heparin 20,000 units, sodium chloride injection 0.45%, 500 ml. How many milliliters per hour must be administered to achieve a rate of 1200 units of sodium heparin per hour? If the IV set delivers 15 drops per ml, how many drops per minute should be administered? So here we have to find out the number of drops per minute by using the rate equals to volume into drop count divided by time. So 15 drops per ml is given, 30 into 15 by 60. So we got the answer as 7.5 drops per minute. So how we find out this volume as 30? From finding out that 20,000 unit is present in 500 ml. So 1200 unit is present in x ml, 30 ml per hour volume that should be administered to the patient. For children, heparin sodium is administered by intermittent IV infusion in a range of 60 to 80 units per kg of the body weight every 4 hours. For a child whose weight is 57 pound, calculate the range in ml of heparin sodium injection containing 5000 units per ml to be administered daily. So 57 pound should be changed into kilogram by dividing by 2.2. So we got 25.9 kg. 60 to 80 is the range. We found 360 to 480. 360 to 480 for 25.9 kilogram of patient. So 9,324 to 12,324 is the range. So how we will find out the required volume of this range? So 5000 is present in 1 ml, so 9000 is present in x ml. 5000 present in 12.434, so for x ml is 2.49. Range of the fluid that should be given is 1.86 ml to 2.49 ml. Calculation involving reconstitution of the dry powder. Certain medication including penicillin and other antibiotics are unstable when stored in solution form, so therefore they are packed in powder form. The dry powder must be reconstituted with a sterile diluent such as sterile water for injection or sterile sodium chloride solution. Instruction is supplied with the vial, how to dilute it, and the resulting volume of the reconstitution drug and approximate average concentration per milliliter are provided in the label. The powder drug may not contribute to the final volume of the reconstituted solution in addition to the amount of the diluent added. If the dry powder adds to the final volume of the reconstituted solution, the increase in volume obtained by the drug must be taken into account when calculating the amount of solvent to be used in preparing a solution of specified strength. Based on this, we have some example. A pharmacist receives a medication order of 300,000 units of penicillin G potassium to be added to 500 ml of dextrose. Vial of penicillin G potassium 100,000 unit is on hand, and the direction on that: add diluent 4.6 ml for a concentration of a solution 200,000 units per ml. How many milliliters of the reconstituted solution must be withdrawn and added to the dextrose 5 solution? So 200,000 is present in 1 ml, so 300,000 in x ml. So we got 1.5 ml. Polymyxin B sulfate, an antibiotic, is in the package of 2500 units per ml. Sterile water 15 ml. So use as directed. What is the direction? The source of polymyxin in a vial of 50,000 of the dry powder, and it is written that add 9.4 ml of the concentration of the solution 5,000 units per ml. Using water for injection as the diluent, explain how would you obtain the drug needed in compounding the prescription. Total polymyxin B sulfate needed is 2,500 multiplied by 15, 37,500 units. So 5,000 units is present in 1 ml, 37,000 units present in x ml, so x 7.5 ml. So we will take 7.5 ml of the reconstituted solution and add water for injection to 15 ml. For example, a medication order calls for 4,000 milligram of Cefazolin sodium to be administered intramuscularly to a patient every 12 hours. Vial containing 250 gram, 500 milligram and 1 gram of Cefazolin sodium are available according to the manufacturer direction. Dilutions may be given, means you have to add solvent 2 ml, 2 ml and 2.5 ml. To make the folio 2 ml, 2.2 ml and 3 ml. How will you get the prescribed amount of 400 milligram? So 250 milligram is present in 2 ml, so 400 is present in 3.2. So add 3.2 ml from here. Similarly, you can solve it for others. For